Stable angina is a condition that causes chest pain due to reduced blood flow to the heart. One of the most common treatments for this condition is percutaneous coronary intervention, or PCI, also known as stenting. The idea is simple: open the blocked artery, restore blood flow, and relieve symptoms. But does PCI actually provide a significant benefit beyond a placebo effect? A groundbreaking study, Orbita 2, aimed to answer this question. The results challenged some long-held assumptions about heart disease treatment. The Orbita 2 trial was a double-blind, placebo-controlled study, meaning neither the doctors nor the patients knew who actually received the PCI procedure. All participants had stable angina, meaning they experienced chest pain, but were not in an emergency situation like a heart attack. Before the trial began, patients stopped taking their anti-anginal medications, drugs used to relieve chest pain. Then, they were randomly assigned to either undergo PCI or a placebo procedure, where no actual intervention was performed. After 12 weeks, the researchers compared the results. The PCI group did experience a reduction in angina symptoms, with lower daily reports of chest pain compared to the placebo group. However, the difference was not as dramatic as expected. While PCI improved symptoms, it was not a cure-all. The study also revealed that some participants in the placebo group still reported improvements, showing the power of expectation and the body's natural ability to adjust. One patient, let's call him James, had struggled with angina for years. He was convinced that PCI would be his solution. When he participated in the study, he underwent the procedure, but he didn't know whether he had actually received PCI or the placebo. To his surprise, his symptoms improved significantly, even though he later found out he had been in the placebo group. This raises an important question: how much of PCI's benefit is due to the actual stent, and how much comes from the psychological and physiological effects of simply undergoing a procedure? This study has major implications for patients and doctors. PCI remains a valuable option for treating severe blockages, especially in high-risk cases or emergency situations. But for stable angina, where the disease is not immediately life-threatening, lifestyle changes, medications, and non-invasive treatments may be just as effective in managing symptoms. If you or someone you know is considering PCI for stable angina, this research suggests it's worth having an in-depth discussion with your doctor. Understanding all available treatment options, including medication, exercise, and dietary changes, can help ensure you're making the best decision for your heart health. The takeaway from Orbita 2 is clear: PCI can help, but it's not always necessary for managing stable angina. The best approach is a personalized one based on symptoms, medical history, and individual needs.